Have you been dealing with chronic hip pain? You keep rolling and stretching the piriformis muscle, you get some temporary relief, but the pain keeps returning? Well, I'm going to explain to you why that's happening, and I'm going to show you how to fix it. Hi, I'm Dr. Joe DeMarco, chiropractor and owner of OcraMed Health. In today's video, we're going to be talking about chronic hip pain associated with chronic tightness of the piriformis muscle. Now, this is an injury that brings a lot of people into my office. I see multiple cases of this every day, and I'm not exaggerating. I treat a lot of this type of issues in my office, and I don't care whether the patient coming in, they can be a runner, they could be a weightlifter, they could just be someone sitting at their desk all day at their computer. These are all different types of people that come in with this issue. And it's not uncommon for these people to tell me that not just that it's been bothering them for months, but sometimes for years. And they come in, they explain how they've been rolling the piriformis, they've been stretching the piriformis, and they get some temporary relief, and then the pain just keeps returning. So there's a reason for this. I'm going to explain it to you, and then I'm going to show you how we're going to fix this so we can put an end to this type of trouble if you're experiencing it, okay? So first off, let's talk a little bit about what we're dealing with here when we're dealing with the muscles of the hip. The piriformis is what we call an external rotator of the hip. So if we're looking at the lower back and the pelvis from the back, this is looking at someone from behind. The piriformis is here. It runs from the sacrum near the SI joint down to the femur down here. So it's that green band right here. That's the piriformis, and it's an external rotator of the hip. So what does that mean? It means that it turns the leg out. So it's turning the leg out. That's external rotation, and coming this way is internal rotation. So the piriformis is an external rotator of the hip. It's going to turn the hip and the leg out this way. This yellow band I made is another external rotator of the hip, which is oftentimes associated with tightness with the piriformis. This is what we call the quadratus femoris. It runs off the bottom of the pelvis, what we call the ischiotuberosity, and that also goes to the femur here. Okay, so these muscles are your external rotators. So they're tight, you roll them, you stretch them, and they loosen up, and then 2 days later, boom, they're tight again. So why is that? Okay, well, you have to sometimes look outside the box on these type of problems. I know a lot of people, whether it's therapists, doctors, they focus in on the area of pain, which is nothing wrong with that, but they focus in on the area of pain so much that they don't look at the cause of the pain. Why is this happening? I mean, you got patients coming in to see you that their problem isn't going away, so there has to be a cause. There's always a cause for a problem when there's an injury in the body. If a problem isn't going away, there's a reason. And when we're dealing with this area of the body, here's the reason. Tightness in the piriformis, quadratus femoris, these muscles are under duress. It's not loosening up no matter how much you roll and stretch it. Why is that? Well, there's muscles of the hip that are internal rotators of the hip. And these muscles include this red band, which is the gluteus medius, this blue band, which is what we call the tensor fascia lata. It comes off the crest of the pelvis here also. Both of these muscles, the tensor fascia lata continues down and becomes the IT band. The glute medius comes off the crest here, goes into the femur. And then I didn't add this in, but the muscles in the front on the inner thigh called your adductors. The adductors, longus, brevis, and magnus, along with the tensor fascia lata and the glute medius, are internal rotators of the hip. Okay, tightness in those muscles, when they get super, super tight, pull the leg in, internally rotates it. Well, if your leg is being pulled in, watch what's happening. As your leg is getting pulled in because of those tight internal rotators, what's happening? I'm putting all this stress now on the piriformis and the quadratus femoris. So they're under chronic tension, they're under chronic tension from the internal rotators. So no matter how much you roll and stretch it, a lot of times you're just going to make it worse because you're loosening them up, and it allows the internal rotators to actually keep pulling it more into internal rotation because you're allowing it to, because you're loosening it up, and those tight internal rotators just keep pulling it into internal rotation. So a lot of times you actually make it worse in the long run. The the solution to the problem is you have to loosen up the internal rotators. We don't think of that because we're not having any pain in the internal rotators. The pain is in the piriformis, so we're focusing on that, but that's not what we need to do. We need to loosen up those internal rotators, allow the hip to relax and come back into a more neutral, relaxed position. The pressure will come off the piriformis. Now you do a little rolling, a little stretching, break up some of the adhesions, and it's going to stay broken up, it's going to stay relaxed, and your pain's going to go away. So that's what we're going to go over today. I'm going to show you how to deal with the adductor muscles, the tensor fasciae lata, and the glute medius, how we're going to loosen that up, give you some stuff you can do at home, get these muscles loosened up, get rid of that tight internal rotation of the hip. It's going to take the pressure off the external rotators, and all is good in the world. So I got a lot of information to go over, so let's get right to it. Okay, so you're having some chronic piriformis issues, some chronic hip pain. We have to determine first off, are your internal rotators part of this problem? Are they causing a problem? So we have to test it. So how are we going to test it? Just simply get on your stomach like I'm doing, and we're going to test, we're going to bring each side into external rotation. If you have trouble getting into external rotation, it's because the internal rotators are tight and they're not allowing the hip to go into external rotation. All you need to do from this position, and this helps if you have someone that can watch you and just give you some feedback on the position of your legs. If not, get in front of a mirror and watch your feet, because you're going to be bringing one foot up at a time, bend the knee at 90 degrees, and we're going to let the leg fall off to the side. That puts your leg or your hip into external rotation, and if your internal rotators are tight, you're not going to be able to go as far. So you can, like I said, you can look at yourself in front of a mirror. You can actually hold a cell phone, and as you're doing it, snap a selfie of each leg to see the position, or simply just ask a friend or a family member to watch. So I'm going to bend my leg up. This is my left leg. I'm going to bend it 90, and I'm going to let it fall off to the side. Now, it's important when you're doing this is when you let that leg drop off to the side, just let the hip go into external rotation without lifting it off the ground. A lot of times with people with tight internal rotators, what they'll do is they'll bring it over, and because it won't move that well, they'll make the motion come by lifting the hip off of the ground. And we don't want that. We want to get a true test of how much limited external rotation we have. So keep that hip on the ground and just let the weight of your foot bring you over. Then take the other leg and come up and do the same exact thing. And we're looking for the tightest side. Now, it has to correlate. So in other words, if it's my left piriformis that's been chronically tight and chronic hip pain, and I bring my right leg up, I drop it over, no problem. It's nice and comfortable. It goes over, no trouble. I come up with the left, which is where I'm having the trouble. I drop it into external rotation. It barely goes over. It's very, very tight. It only goes a half as far. And that's the side I'm having my trouble with. It just shows that those left internal rotators are tight, so we're going to need to get to work and loosen them up. So that's the test. You're going to do one leg at a time, drop it over, do the second leg, drop it over. If the side where your symptoms are is your tight side on that test, then that means your problem, your piriformis issue, is most likely the result of tight internal rotators of the hip, and that's where we're going to go next, how to do some fascia release on them and how to stretch them. All right, so let's mash up some of those adhesions on those internal rotators, okay? So once again, the tensor fasciae lata is this blue band. It's a little bit, it's more in front. It's on the front part of the pelvis here. The red band is the glute medius. As it comes off the top of the femur, it fans out, so it covers this area of the pelvic crest here. So we're gonna nail both of these right now, the tensor fasciae lata and the glute medius. So how are we going to mash up those adhesions? Of course, we're going to use a Tai Chi ball from OcraMed Health. The texture on these things are going to dig out those adhesions. It's also small enough to fit into the small spaces where those muscles are located. A huge foam roller is not even going to do anything. It's just you're not going to get into the tissue that you need to get into. Okay, so tensor fasciae lata. As I said, if you're lying on your back and you feel the very front part of that pelvis, that tensor fasciae lata is right about here. As I said, it goes down and continues into the IT band. So I'm going to put my legs straight. I'm going to get right to the front of the pelvis. So if I feel the front of my pelvic bone here, right off to the side, I'm going to get onto that tensor fasciae lata, and I'm going to roll right onto the ball. Now, the tensor fasciae lata is a thin muscle, and so gauge your pressure, because as you roll onto the ball, it's almost going to be like you can feel the ball digging into the bone almost. So be careful with the pressure that you apply. And roll onto it, and once you're onto that tensor fasciae lata, just kind of rub back and forth, up and down. Spend about 30 seconds just kind of mashing that tensor fasciae lata with the ball. Once you've done that, give it a second, take the pressure off, then roll back on, and then just hold your body weight onto the ball, into that tensor fasciae lata. And now what I want you to do with your leg is rotate it. I want you to go internally, externally, and go back and forth for about 30 seconds. And you may want to move the ball, a couple times when you were mashing it back and forth, maybe hit a couple different little spots of the tensor fasciae lata. And now as I'm doing this, I might do it a couple times on a couple different spots. But I'm just going to go back and forth. And when you do this, you can really feel that Tai Chi ball just kind of digging into any adhesion that's in there and breaking up that tissue. Okay, next we're going to get to the glute medius. This time I'm going to bend the leg up. The glute medius is back a little bit further along that pelvic crest. Once again, I'm going to get the ball along it. I'm going to roll onto my side, onto that ball. Gauge your pressure once again. This is another area. That ball is going to get in there nice and deep because of the texture and the size. So gauge your pressure. And once again, we're going to kind of mash it up a little bit, back and forth, up and down. Spend about 30 seconds mashing it. Move it around 2 or 3 times. Then take a little break, come back on top of it, and now what we're going to do is once again rotate. I'm going to lift my foot off the ground, bring it down, knee off the ground. Foot off the ground, knee off the ground. And I'm going to do this for about 30 seconds, and like I said, then I might hit another 1 or 2 spots. Okay, so we got some mashing on 2 or 3 spots, then we're going to hold pressure on 2 or 3 spots, where we're just going to do this simple motion, knee off the ground, foot off the ground. Okay, so that's going to take care of some fascia release work on the tensor fasciae lata and on the glute medius. Other area that we have to work, little fascia release work, is going to be on the adductor muscles, which are also involved with internal rotation besides adduction. So let me go over that with you right now. Okay, so we're going to hit those adductor muscles. On this diagram, like I said, we didn't add in the straps, but the adductors are coming off the inside of the femur bone, and they're coming up into the front of the pelvis, or what we call the pubic bone. And these muscles adduct or bring the leg in towards the center line, but they also are involved with internal rotation. So we're dealing with 3 main ones: adductor brevis, adductor longus, and adductor magnus. They're the muscles on the inside of that thigh area. They're thick muscles. They're thick muscles in here, but they're very sensitive. So you may want on this one to do a little light foam rolling with a regular roller, just to get a little blood flow in there first before we start in with the Tai Chi ball. Maybe just roll it out for a minute or so, get some blood flow. Then we're going to get the Tai Chi ball. Now what I like to do, and you're going to have to get creative at home, I'm going to take some type of a chair. If it's a padded chair, put a book on top, because you want something firm so that the ball doesn't sink into the foam. And then try to find something that's of height so that you can actually bring your leg up onto it, so that the inner thigh is up against the chair. So I actually have my leg, as you can see, kind of rotated like this, okay? So get creative at home, see what you can come up with, but try to get the leg up. And then you're going to get that Tai Chi ball right on the adductors in there, in this position. So once again, it's a little bit of a sensitive area, so gauge your pressure. But once you're on it, kind of dig around in there, forwards and backwards, side to side, and spend a little time mashing different spots, 30 seconds on each spot. It's a lot of muscle in there, so you might have to move this ball 4, 5, even 6 times around. But go all the way from deep into like the top of the thigh, all the way down the side of the thigh, and get those adductors, okay? Once you do that, come back again and just hold firm pressure down with the leg on top of the ball. And if you can set it up properly with the chair, or I'm using a stool, I want you to start bringing the leg once again, internal rotation, external rotation, internal rotation, external rotation. So if you can do that, maybe you can have a chair where you can hang your leg off a thin chair. You can do this part of it too, where you're just going to be externally and internally rotating the leg on each spot for about 30 seconds and then move it into different spots. So, you know, as you can see from here, you know, I'm going to try to do the best I can to kind of get that internal, external rotation so that that ball digs into that area. Now, those three maneuvers for the tensor fasciae lata, the glute medius, and then for the adductors with using the ball is a great way to do some fascial release work. I do want to share, you know, we've had a lot of great response to our shock release instrument, our SRI, and this is a perfect opportunity to use that instrument so just to help out those people that have purchased a unit. I just want to take a quick second. This isn't a sales pitch. I just want to show these people that have them at home now how they can utilize their SRI on a particular problem like this. Is you can get in with that SRI and all those muscle groups that we just talked about. So if I'm lying on my side, you don't need anyone to do this for you, but you can actually get your SRI right on that tensor fasciae lata. Just pull the trigger, it'll stay. Once you pull the trigger, it stays on automatically. Find a nice tender knot on that tensor fasciae lata, and I would just hold it there for about 30 seconds and then move on to a different knot. Maybe get 2 or 3 knots in that tensor fasciae lata, then move on to the glute medius. Once again, 2 or 3 spots. Once you find the knot, you don't necessarily have to be rubbing it around. You just find the knot and just hold it on and just let it do its thing. And that's how the SRI, the shock release instrument, works. Is when you have a knot, research has shown when you just basically pound on that knot repetitively like that, it breaks it up. It helps break it up. So tensor fasciae lata, glute medius, and then you can just sit up and get right on those adductors. Once again, find some knots. And each knot that you find, hold it on for about 30 seconds. So anyways, that was just to share something with the people that have picked up those shock release instruments. Let's move on to some stretches. All right, so let's stretch out that tensor fasciae lata, or what we call the TFL. We're going to do it, we're going to almost be in a position as if we were doing like a typical hip flexor stretch, or what they might call I don't know if some people call this a hurdler stretch, but this type of a stretch where a lot of times people want to stretch out their hip flexor and they just lean forward like this. So it's going to look something like that. This leg is at about, the knee's bent at about 90 degrees. You're going to need something to hold on to. It's kind of hard to do this stretch without something. So as opposed to a normal stretch where I'm going to work the hip flexor, I'm going to first bring this leg so that my foot is in front of this knee. So I'm stretching the left tensor fasciae lata. So I've placed my foot in front of the knee. And the key to this stretch is before we start to lean forward, we want to let the hip drop off to the side. So I'm going to go from a nice, good postured position here. I kind of call this like a sluggish hip flexor stretch. So instead of being a nice posture, nice upright position, what we're going to do instead is just let it relax and drop the hip out. Now, with the hip out to the side like this, I'm going to slowly start to come forward. Now, normally on a hip flexor stretch, I'm going to come way forward like this to get a good stretch in here. But you don't need to on this. You're going to have the foot in front, you let the hip drop out, and then just slowly just start to come forward until you start feeling stretch on that tensor fasciae lata. And you actually don't need to come forward too much to start feeling it. Like I'm dropping the hip off and coming forward right now. As you can see, I'm not too far forward, and I can already feel a great stretch on that tensor fasciae lata. So this is an excellent stretch, how to nail the tensor fasciae lata. Let's move on to the glute medius. Okay, glute medius, I'm going to stretch my right glute medius in this stretch. I'm going to get down on all fours. I want to try to have the knees about shoulder width apart, but they're lined up with each other, and my hands are lined up with my knees. And stretching the right glute medius, I'm going to take my right ankle and I'm going to bring it across into my left knee. So I'm going to just show you the position. We could turn here and you can see the position. I'm pulling my ankle into the bend of my left knee, just like that. So from this position, bring that ankle around into the bend of the left knee, and I'm going to hold it with my left hand so that I don't let it move from that left knee. I want to keep it firmly up against the left knee. Now, the important part of this stretch, we don't want to just start to lean back. We want to actually stick the buttocks out and flatten the lower back. And from this position, we want to slowly bring the hips back, and you don't need to go very far, and you will start feeling the stretch on the glute medius on that side. So sometimes I see people, they bring this across, and then they kind of round the back, and they go way, way back, and they're really not stretching that glute medius in this position, even though they're going way, way back. If you hold this foot in position, stick the butt out, flatten the back, you don't even need to go very far, and you're going to start to feel that stretch on the glute medius. You're going to hold it for 30 seconds, and you're going to do it for 3 times for 30 seconds. Okay, and finally, those adductors, we're going to stretch them out now that we've done that fascial release work on them. Two of my favorite adductor stretches that we're going to use. One is just from the kneeling position, hold your weight forward like this, and just let each of those knees, I have my knees bent at about 90 degrees, and I'm just going to let them slide out as far as I can. So I'm just going to bring them out further and further and further, and try to lower your pelvis down to the floor as far as you can. Once you find a nice position, just hold it for about 30 seconds. Then I'm going to have you come up, drop into a squat position, have the feet turned out slightly, drop down, take my elbows against my knees, and I'm just gonna, you can either push this way, or I like to just even open my arms and just use my hands and just push out those knees as far as I can while I'm in a deep squat, and I'm gonna hold that for 30 seconds. So I'll go 30 seconds from the ground, I'll come up, I'll get into this stretch for 30 seconds, and I'll do those 2 stretches, I'm gonna do them in combination 3 times. All right, so there you have it, boys and girls. Loosen up those internal rotators. It's gonna solve that chronic piriformis issue that you've been experiencing. Like I said, whether it's been for months or years, give it some time. As you know from previous videos, when we're doing stretching, we're doing fascia release work, it doesn't happen overnight. Think about it. If your piriformis has been bothering you for a year, chances are those internal rotators were tighter for even a longer period. They might have been tight for 2 years, and after a full year of being super tight, then your external rotators started to get symptoms. So we're dealing with an area that has probably been chronically tight and very bound up longer than your actual symptoms have been there. So give it some time. Spend every other day working the stuff I just went over. Give it at least 4 to 6 weeks. Don't expect to see results immediately, okay? So hang in there. I know this is going to help. I treat people with this in my office all the time. Loosening up those internal rotators, we get great results. All right, exercise programs, mobility plans, our new shock release instrument, all available on my website, www.OcraMedHealth.com. If you're enjoying these videos, please subscribe to my channel, OcraMed Health on YouTube. Questions about exercises or injuries, just leave a comment in the comment section below. I always get back to everyone who writes in. And don't forget, OcraMed Health is here to keep you fit forever.